Okay, great. Well, welcome everyone. Thank you so much for coming. We're thrilled that you guys made time this evening to come out. This is a really special night for us because we don't normally have our international program leaders in town in Chicago. And so we thought we'd make the most of this and get to brag about the work that we all do. So anyways, thank you all for coming. Just a high-level overview on Heartland Alliance International. We have, about 16 programs in 6 countries right now. Our biggest country operations are Iraq, Colombia, Dominican Republic, but we also have programs in Nigeria, Cote d'Ivoire, and we're really excited to talk about all of that. In addition to our amazing Marjorie Kovler Center here in Chicago. I knew that would get an applause. That was an easy one. So anyhow, a lot of the work that we do is to help refugees and displaced persons overseas. I think everybody is familiar with the various conflicts that are happening around the world, different issues when it comes to like climate change, political and economic crises, etc. Sorry, closer? Oh, okay. All right. I'm not used to a microphone, y'all. I'm sorry. So what we do in different countries is it's a little different. I mean, a lot of our clients are, USAID, U.S. Agency for International Development, State Department, Population, Refugee, and Migration, State Department, Trafficking in Persons, and of course, United Nations, Human Rights. So we're happy to talk with you about the programs that we're doing overseas, and we want to get to know you guys too. So I'm going to introduce our esteemed panel. We're very lucky to have everybody up here. And then they're going to give you some high-level information about the work that's happening in their country, the situation that's happening there in terms of human rights. So first, I'm very pleased to welcome Carolina Zapata Estevez. She is a human rights advocate with over 10 years of experience defending the rights of vulnerable groups, including those affected by displacement, statelessness groups, and human trafficking. She's the country director for Heartland Alliance International in the Dominican Republic. Carolina leads initiatives that improve the rights and well-being of the country's most vulnerable and marginalized communities. She also serves as the chair of the Civil Society Coalition Against Human Trafficking and previously held positions with Save the Children, UNHCR, UNDP, UNICEF, and Welcoming Atlanta, among other international organizations. Let's give it up for Carolina. Maria Alejandra Torres. She's the Director of Humanitarian Programs at Heartland Alliance International in Colombia. She has 16 years of experience in humanitarian aid, development cooperation, and design and coordination of risk management projects for disasters, with an emphasis on technical advice for the inclusion of differential approaches. She's provided humanitarian aid to victims of the armed conflict in Colombian Southwest for 12 years. I saw her on the ground. She's amazing. Maria Alejandra. I think we... Great. Dr. Chonye Bartholomew Boniface, also known as OBB. He is Heartland Alliance International's Nigeria Country Director. In this role, he leads one of the largest HIV/AIDS treatment and prevention care programs for key populations in Nigeria, including LGBT community, sex workers, and injection drug users in sub-Saharan Africa. OBB is seriously a leader in Nigeria's HIV/AIDS prevention and treatment efforts for marginalized communities. He has written the book in terms of like how you do this and teaching donors how you do it. He brings 20 years of dedicated experience in public health and human rights, authoring 11 research publications. OBB has presented on using human rights-based interventions to address HIV/AIDS in key populations at conferences around the world, including United Nations General Assembly high-level meeting on ending AIDS in June 2016. He holds a PhD in public health, so yay, OBB! And last but not least, Scott Portman. Scott is filling in for Ahmed Samir, who's our country director from Iraq. Sadly, could not get his visa in time, so we're all mad at the State Department there. But we are very lucky to have Scott Portman. He is our country director for regional programs in the Middle East. He's a technical advisor on a variety of things and a huge global human rights champion. So throughout his tenure, he's been with HAI, or Heartland, for 25 years. Scott has designed and implemented innovative programs in both mental health and access to justice sectors, with a focus on torture treatment, forced migration, human trafficking, gender-based violence, child protection, and programs for religious and ethnic minorities. Scott has extensive experience in Iraq, serving as the International Rescue Committee's director in Iraq from 1991 to 1992, as the program officer for the U.S. Office of Foreign Disaster Assistance from 1992 to 94, also based in Iraq, and he started HAI's Iraq programming in 2004. So thank you, Scott. Cool, and before we get started, I want to give a shout out to the Deckham team who made all of this possible and did amazing work last night. I want to call out to Mary, Nancy, Celeste, and Angela. Thank you guys for everything you've done to put this together. Yes, there she is. All right, so let's get into it. So I'm going to go first to Carolina to talk about situation in the Dominican Republic and tell us a little bit about the work there.
Okay, my pleasure. But first, I want to know who knows the Dominican Republic. I see a lot of hands. I like that. So I bet you know Sammy Sosa, who used to play for the Chicago Cubs. Of course, there you go. And I bet that you also know that we're known for our bachata, our merengue, that we love to dance, right?
We can do that later.
We can do that later. And all those things are true, right? But today I want to shed some light on the human rights complexities of Dominican Republic too, as lack of immigrant rights, statelessness, as Melissa mentioned before, gender inequity, and human trafficking. We are a small country, only 10 to 11 million people in the Dominican Republic. However, immigration is a topic always on the table. We are in the Caribbean. We are the country who received the highest number of asylum seekers and migrants from Venezuela. But also due to our unique location and I would say geographic characteristics, as we are one of the few islands in the whole world shared by two different nations, Haiti and the Dominican Republic. Of course, we receive a lot of migrants from Haiti too. And of course, those migrants have kids, and then we have an amazing community of Dominicans of Haitian descent. Among those communities of Dominicans of Haitian descent, we have now over 100,000 people in statelessness. That means these people do not have access to education, do not have access to health, do not have access even to buy a phone because they need an ID to do that. So their lives are suspended right now. When you cross all this with gender inequity and the human trafficking, we have that women, girls, and boys are in high vulnerability to fall in these networks of human trafficking, but also to be victims of gender-based violence, domestic violence, and all these manifestations. But not only human trafficking for sexual exploitation, but also forced labor. So we have a huge amount of people in this situation in the Dominican Republic, sadly. However, HAI, Heartland Alliance International in the Dominican Republic, we are working to address these situations. And because while people are waiting for solutions for the immigration status or for an auction for nationality, they still need services, right? They are living, they need to live. So they need mental health, they need legal assistance, they need to pay for food, they need to pay for their houses, they need to do something so their kids can go to the school. So what we do in a very comprehensive approach is that we provide these services. We have an amazing team of psychologists, legal lawyers, and humanitarian assistants that are providing services to these people, and not only providing to them, but working with the communities. We are proud to say that we work with more than 30 community leaders that they're part of Heartland Alliance International nationwide, and they replicate the knowledge they gain for the HAI programs in their communities. And in terms of human trafficking, as Melissa said before, we are proud to be the chair of the Dominican Civil Society Coalition Against Human Trafficking, who gathered together more than 16 civil society organizations who in the daily basis, we are advocating for changes in the laws and public policies for the protection of human trafficking victims in the Dominican Republic. And I want to congratulate the Dominican government in this, because in human trafficking, they are doing their effort to really make changes. However, we still have a long way to go. And we are proudly only to say that now we are working very closely with the National Police, the Ministry of Justice, the Ministry of Women, and the National Council for Child and Adolescents, so we can incorporate a trauma-informed care approach in all the shelters in the Dominican Republic. So we can assure that all those human trafficking victims in the Dominican Republic can receive the services they need to recover their life. Since we started in 2010, we have served more than 14,000 stateless people in the country. And we are proud to say that. And more than 6,000 Venezuelans who we are helping to accompany them to get services in the Dominican Republic. However, we still need to do more. And I'm really happy to be here because now all of you know what is happening in the Dominican Republic. You can spread the word that we need people to know that in the Dominican Republic we have stateless people, and we need the Dominican government to pay attention to that, and we need the civil society, the international cooperation to focus on that, so this life can still live, these people can live their life as they deserve. So thank you very much for your time.
Good job. Amazing. Thank you so much. Maria Alejandra, could you tell us, give us an overview of the human rights situation in Colombia and tell us a little bit about the projects that your team is managing there?
Yes, of course. Thank you, Melissa. Good evening, everyone. I am very excited to be here sharing with all of you. I want to thank you for your interest in our work. As some of you may know, Colombia is currently in the spotlight because of the two simultaneous humanitarian crises. Violence caused by 6 decades of armed conflict affected more than 9 million victims, and a massive migration influx of nearly 3 million Venezuelan citizens that have arrived with great needs. Despite the efforts to end conflict through a very comprehensive and ambitious peace accord with one of the armed conflict groups, creating hope among society, there had been limited political will and capacity for its implementation. Human rights violations among vulnerable communities persist. Likewise, although Colombia has opened its border to receive Venezuelan migrants and refugees and created opportunities for their integrations, hundreds of thousands still have unmet basic needs and face risks of protections. Our work in Colombia to protect this vulnerable population is based on the direct provision of multi-sectoral service through mental health, psychosocial approach, access to justice, economical empowerment, and temporary shelter solutions. We focus on reaching the most vulnerable in the hardest and most undeserved areas of the country. In the past 5 years, HII Colombia has reached more than 120,000 affected individuals in 11 departments of Colombia through 10 projects and funded by 5 donors. Only in 2022, we were able to provide more than 140,000 multisectoral services. But we do not do this alone. We partner with communities, civil society organizations, local authorities, and other international actors through the coordination of actions to fill the gaps and protect human rights of those who need justice and healing. The majority of conflict survivors and vulnerable migrants are women. Thousands of LGBTIQ+ individuals are also affected by this crisis. They both face additional risks suffering GBV during displacement or forced migration. Our team has developed a well-recognized expertise to support them with intersectional approach and strengthening their resilience, empowering them to rebuild their lives. To date, we have served more than 5,000 GBV survivors and helped them to continue their path forward. Thank you, Melissa.
Thank you so much. That was incredible. Thank you. OBB, can you tell us about the situation in Nigeria and some of the impacts that your projects have had?
Sure, thank you very much. So for those of you who may not know, Nigeria is the most populous black country in the world with a population of over 200 million people and highly, highly diverse. We have over 250 languages, over 400 ethnic groups. So the diversity is so much, and that is how diverse our situation, our circumstances, and our problems are as well. And Nigeria is a very religious country, as some of you may need to know. And we have a lot of human rights issues affecting minority groups, especially sexual minorities. As you know, my other colleagues have mentioned, we have the LGBTIQ persons who suffer a lot of stigma and discrimination. We also have people who have social discrimination, like sex workers. They are not accepted. You have people who use drugs. You have transgender persons. You have, people who generally engage in practices that are not widely accepted. And so most of these suffer a lot from the hands of even service providers who may not be well sensitized around those issues. We also have issues around extreme poverty in Nigeria, and those are factors that also contribute to some of the challenges we have, health, social, and economic. We have a lot of issues around armed conflicts. Some of you may know what is going on with the Boko Haram in the northeastern part of Nigeria. We have also issues around gender-based violence that is also implicated in terms of how these issues affect women and children and other populations. Currently, Nigeria has over 8.3 million people needing humanitarian assistance, over 4.4 million suffering acute hunger, and we have diseases outbreaks. The recent monkeypox is a case in hand where WHO is trying to work with the Nigeria Center for Disease Control to address. We also have COVID-19 burden, which was a big deal and affected not just the health sector, but also the social and economic issues. Talking about health, Nigeria is the country with the most or highest disease burden as far as tuberculosis is concerned in Africa. And among the 30 countries that are affected by tuberculosis, Nigeria ranked 6th. And as far as HIV burden is concerned, Nigeria ranks 3rd, with over 1.8 million people living with HIV. And as of now, Heartland Alliance is supporting over 260,000 persons placed on sustained antiretroviral treatment in Nigeria, including women and children and the LGBTIQ persons. It will interest you to know that as a result of stigma and discrimination, a lot of the LGBTIQ persons, sex workers, people who inject drugs, are driven further underground. So even when services are available, it is very difficult for them to access those services. And so what Heartland Alliance has done is to work around those issues, engage directly with the community, train the community members as service providers so that they are able to engage with other community members in places that are safe, in places that are, less stigmatizing, in places that are also far away from, law enforcement agents who might, arrest and raid those places. So we have been able to support over 110 public health facilities, training service providers to be able to understand the issues around providing services for the marginalized population. We have also been able to gather people who have these issues and train them, not just technical training, but also institutional capacity building. And through that, we currently have 55 community-based organizations, and some of those community-based organizations are led by community members. So that has actually opened up the space because these community members are also trained to demand accountability from government. And so in some of the settings, they are also invited to come and sit around the table where discussions are made that will impact on their lives. We've also been able to, we also implement programs around trafficking, anti-trafficking, because in the northeastern part of Nigeria, a lot of trafficking go on as a result of the insurgency. It's different from the traditional trafficking that goes on. People come in the name of trying to help people and they move them in droves to other locations. And so that is different from the trafficking that, other organizations like IOM and the rest are working on. But we are supporting and complementing the work that IOM is doing by focusing on trafficking that is related to the insurgency. So we have a great partnership with them. And through that, we have been able to support the formation of a task force. It is called the Anti-Trafficking in Person Task Force, which operates to bring stakeholders together, government, Ministry of Justice, the National Agency for Prohibition of Trafficking in Persons, traditional leaders, faith-based leaders together to further understand the issues. We've also supported the development of referral mechanisms so that people know where to refer victims to and to be able to access services. We've been able to also support and integrate mental health and psychosocial support services, access to justice. We work very closely with the National Human Rights Commission, and they have really, really helped to support, to get justice for people whose rights have been violated. Because of the increased number of women and children, of course, men and boys, suffering gender-based violence, we've been able to establish what is referred to as sexual assault referral centers. So these sexual assault referral centers are safe spaces where victims of rape, victims of sexual harassment, they are able to walk into those spaces. They have proper examination by trained healthcare professionals. They have access to legal clinics. They have access to getting evidences against those who perpetrate those crimes. And we work very closely with the Nigerian police to be able to pursue investigation. And some of these cases end up in court. We have challenges, of course, with prosecution and all of that. But it's a process. For COVID-19, we've been able to support the vaccination of 26,000 Nigerians to be able to access COVID-19 vaccination. Of course, it's a tall order because there is still a lot of denial around it. People really don't want to get vaccinated. There are a lot of myths and misconceptions around it, but we've been able to work around it to provide those services. In terms of sustaining some of the interventions that we do, we have issues around access to condoms. For HIV prevention, condom is proven as a good preventive technology for HIV transmission. But trust me, condom can be scarce, especially for sex workers and for people who actually need those. Lubricants is a luxury. And so one of the things we are doing is to try to work around actual production. You know, of course, with the support of people who are interested in helping us to do that. And we also discovered that there is inadequate capacity, especially at community level. So one of the initiatives we are promoting and experimenting is to have an institute. We call it Gravitas Institute. So the Gravitas Institute help to build mid-level managerial skills. And these are for purely community service providers. Currently, we've trained over 300 of those service providers. They understand monitoring and evaluation. They understand project management. They understand reporting. They understand data management. And they understand leadership, financial management, and so on and so forth. So that has really helped to build capacity at that level. Of course, we couldn't have succeeded in doing all of this without very important partnerships. So we partnership with some UN agencies, Global Fund, USAID, CDC, some embassies like the Netherlands Embassy, and so on and so forth. Before I hand over to Melissa, I want to say that Heartland Alliance Nigeria is actually birthed from the work that Heartland Alliance International has done in Nigeria for over a decade. So we have a local organization that is helping to continue the wonderful work that Heartland Alliance International has done in the country, while Heartland Alliance International continues also to do the work that they are doing. So thank you very much.
Awesome. Wow. That's a tough act to follow, but I'm sure, Scott, you can give us some interesting things to go on with our work in Iraq, too. Thank you, OBB.
Well, it shouldn't come as any surprise to anybody here that human rights is central in Iraq, and Iraq faces tremendous human rights challenges. Anybody who's paid any attention to the news over the last 20 years would agree to that. Iraq is maybe a remnant of the Ottoman Empire. It's a diverse, multicultural, multi-religious society that faces deep divisions and is trying to knit itself back together after 40 years of conflict, at least 5 major conflicts, after a dictatorship, after a horrible conflict that just ended with the Islamic State, and is trying somehow to knit itself back together to become a unified society once again, with respect for individual rights and respect for collective rights. We use a slogan, we say, there's no justice without healing and no healing without justice. I think we've talked, we do both in Iraq, but we've talked mostly about the healing end of things because a lot of the programs that we work on in the other countries, for my colleagues, have a big focus on health, although they also have an equal focus on justice. I might talk slightly more about justice as far as Iraq is concerned, but I do want to emphasize that we do the work of healing there as well. Since the beginning in Iraq, we've really focused a lot on torture treatment and prevention. In terms of torture treatment, we've worked to try to integrate torture treatment and mental health services into the primary healthcare system. And we've tried to establish, we've tried to train and prepare more advanced mental health workers in Iraq that can respond to the needs of torture survivors above and beyond the basic psychosocial services, including through the establishment of a torture treatment center and working with the universities in the past to start up social worker and psychology training programs. Another consistent area of practice in Iraq has been gender rights. So we've worked hard to pilot programs bringing together social workers and lawyers for women's organizations, within women's organizations, to work on gender-based violence, either domestic violence and intimate partner violence or community violence against women, to develop effective strategies to combat that with our Iraqi colleagues. So I use the word we a lot, but I do want to emphasize, just as in the other countries, we work with our local counterparts and we build the capacity of our local organizations. In that regard, I do want to say that also in Lebanon, we gave the first grant to Abad, which is now by far the largest Lebanese women's organization. And actually, we are no longer work in Lebanon because we can't compete with them, nor do we want to. And the other thing that I would talk about briefly is juvenile justice and the rights of children. Iraq has had a rather tragic history of recruiting child soldiers. And before that, it had a rather tragic history of children being caught up in the criminal justice system and treated as adults or mixed together with adults. So we've done a lot of work in terms of training the judicial institutes, in terms of training the police, in terms of working with Iraqi organizations to protect the rights of children. And most recently, partnering with UNICEF, we're the major provider of legal services for children that were forcibly recruited by the Islamic State and now face terrorism charges. In terms of specific accomplishments, one thing that stands out, I think, is that we established the first torture treatment, and to date, the only torture treatment center in Iraq, which is now independent and which has been in existence for 15 years and is now an institution. It's modeled on the Kovler Center, and it would be wonderful to continue that relationship with Kovler Center because we're always looking at ways to bring together our domestic and international programs. Working with our partner DHRD, we managed to secure the conviction of 3 policemen for torture. You might know in Chicago, it took a whole lot to get John Burge convicted. So you can imagine how difficult that was in Iraq and how courageous actually our Iraqi counterparts are. We also trained Iraqi judges in the aftermath of the Islamic State. I don't know if I can adequately express how pissed off people were at the Islamic State. I mean, really ragingly angry. And many, many people were facing terrorism charges after the Islamic State was defeated. We trained judges who, at tremendous risk to themselves, acquitted a number of defendants because the evidence against them for being members of the Islamic State was based entirely on torture-extracted confessions. Now, these judges faced death threats from this. I want to emphasize what we do is minor compared to the courage of our Iraqi colleagues. The other thing that, in terms of gender rights, we've tried to train and help prepare women for careers in politics. And I know, once again, the numbers may not seem large, but we have managed to help 8 women become elected to federal offices and offices in Kurdistan, but more than that, become re-elected. We've actually managed to get 25 or so get elected. But 8 of them re-elected and started on political careers and started on a career of public service and a career of importance and striving for equality in their society. I would also say, and I hope that we can expand this and work to deepen this work, but we really piloted the work on customary law, bringing lawyers and social workers together to mediate gender violence and to make sure that women have access both to the formal legal system and the customary system. And one little aside about that, there's a form of marriage called fasaliya marriage, where women are exchanged to solve disputes. So, for example, if there's a murder, one clan may exchange a woman to solve the murder. And murders are oftentimes never make it into the criminal justice system at all. A lot of times they're solved informally. Or for a land dispute or something like that. So our excellent gender coordinator in Iraq managed to get an agreement to end this practice in Basra with the governor and a number of tribal leaders, because women are not commodities to be used to solve debt. They're individuals, and most Iraqis eventually agree to that, and certainly most Iraqi women would agree to that. I'd also like to say, we've done a lot to try to protect LGBTQ people in Iraq. There's a huge stigma against that. Over the years, I think we've gotten out about 90 for whom there was no possibility of staying in Iraq. And also, you won't notice them, you may walk by them on the street, but we've gotten 5 women who are facing honor killings in Iraq for whom there was no safe alternative in Iraq because their families were tribal leaders or politically connected or connected to the police. There was no way to hide them in Iraq. And they walk among you in Chicago. So you never know who you're going to meet on the street here. The final thing, I think, are juvenile justice programs. I remember the first time I went with our country director into the jail in Tel Cave. And there was 1,000 kids in that jail, adolescent boys. And the country director at the time turned to me and he said, "Do you notice how silent it is in here?" And I was shocked. I hadn't noticed that. I was thick-headed. You can't put 1,000 boys in a couple of rooms and have them completely silent unless you have them terrorized. So all of these kids were facing charges for being members of the Islamic State. With the support of UNICEF, we've provided legal representation to them. We've effectively ended torture of kids in detention. So, and again, when I say we, I'm speaking mostly about the Iraqi organizations and staff that we work with. It's a real shame that Ahmed couldn't be with us tonight.
Thank you. Thank you so much. We have a couple of round robin questions that I'll ask the panel, and then we've got a short video too, because we wanted to make sure that we hear the voices of our participants in this conversation. Wow, I just want to give a round of applause for our panel. This was really moving, and I know I learned something, and I work with this team. I'm so proud to work with this team. Just opening it up to the group, our work. We've talked a lot about different issues and different populations and social issues in each of the countries. How would you guys say that it fits together? How do you feel like you connect to the broader Heartland Alliance community and the strategy? Maybe, shall I start with Carolina?
Of course, why not? You know what? That's interesting question because we have many different contexts. However, we all are working with human people, right? So we need the same. We need love, we need rights, we need compassion. So in case of a collaboration with other offices, other programs, we're very close to our friends and colleagues from Colombia because we're both working with Venezuelans, asylum seekers and refugees and migrants, and we are working in similar programs. So I always reaching out to our Colombia team and then to the Dominican Republic team as well to exchange experience. Like this is kind of a community of practice, if you can name it like that. And it's incredible how similar are the approaches that we implemented in the different ones. And I will say, in terms of human trafficking, even though Nigeria is very far away, time zone different, cultural differences, but in our human trafficking programs, we have been replicating a lot of the lessons learned from the team in Nigeria because we are developing SOP for shelters. We are developing strategies to work with the government. So our team in Nigeria have been done that for a long time, and we are not creating from zero. No, so we are contextualizing to what is happening in the Dominican Republic, but we already have a background of information now. That's the magic of Heartland Alliance International and the cooperation we do between our programs.
Thank you so much. Thank you. Does anybody else want to jump in and say how, especially I know everybody here is interested in how we work together, like how we knit together our domestic work and how we knit together our international programs, and we ensure that we are delivering a cohesive strategy.
I would like to. You hearing me? Yes.
Yeah.
In the same sense that Carolina said, I would like to highlight that in Colombia we have a robust program quality strategy that leads the knowledge management and technical guidance for assure the best and most timely service provision. But I think that what is common to all of the countries for Heartland Alliance are our values, and I would like to highlight that. Our work is very different globally. Nonetheless, it is our values that help us to have a cohesive strategy because it requires courage to do our work. The communities deserve respect and excellence, and integrity help us to honor our commitments with the participant, our partners, and our team that are who make this work possible.
Wow, thank you. And I think that's a perfect segue when you're talking about the participants' voices. I think we should turn to the video and get a peek into what our participants are saying about our work.
De tantas huellas que tengo, que son realmente importantes, y es la aceptación de esos niños, de esos padres, y aceptar que una mujer negra, una mujer trans, una mujer diversa, capacite y forme a sus hijos en derechos humanos, en derechos de no violencia contra la mujer, en derechos de la población LGBT, en derechos del cuidado del medio ambiente, en derechos del amor propio, y que desde allí podamos construir una sociedad con igualdades, con derechos. Creo que eso es una historia bastante, porque a pesar que el estigma, la discriminación y los señalamientos y los prejuicios no nos han dejado avanzar, pero demostrar que en el departamento del Chocó somos diferentes y que en esa diferencia somos respetuosos. Y eso permite realmente esta historia mostrar que sí podemos trabajar por las comunidades.
أنا خضر من الحمدانية قراقوش، عمري 23 سنة. نزحنا بوقت داعش 2014 إلى أربيل، وبعد التحرير رجعنا إلى مناطقنا في 2018، وشفنا مثلا مناطقنا متدمرة ومبيوقة ومتأثرة هواية، يعني آثار الحروب. وورا فترة يعني 2021 كانت تعرفت على صديق هو اللي قال لي مثلا على مشروع العودة الآمنة، قدرت أسجل به وأسجل مشروع الألمنيوم. كان وراها من طلع اسمي، أخذت دورات تدريبية ودورات تسويقية، وقدرت يعني أحصل المنحة وأفتح المشروع مالتي مال الألمنيوم. بعد ما فتحت هذا المشروع هو صار يعني مصدر رزقي، وتحسن وضعي الاقتصادي، وقدرت أساعد به عائلتي عن طريق هذا شغلي.
Mi nombre es Ramonita Regala, tengo 24 años y tengo 3 hijas. Yo antes de tener la residencia, yo trabajaba en un picapollo, lo cual me votaron por no tener documentos. Yo fui al interior y policía a poner una denuncia que se me había perdido mi primer carnet verde, y de ahí conocí a una persona que me pudo contactar con Jael de Hais, y de ahí pude tener mi residencia permanente. Después que tuve la residencia, yo pude conseguir trabajo. Duré 3 años. Cuando nació Helen no la querían declarar por ser de madre dominicana de padres extranjeros, y tuve que contactar a Jael, que gracias a ellos me ayudaron a declarar a Helen. Helen es la primera niña de padre dominicano en riesgo de apatridia que obtiene la nacionalidad dominicana. Yo agradezco a las personas de High, a los abogados que me pudieron ayudar en ese proceso. Y gracias.
Awesome. I want to see that video later after this. We haven't gotten a chance to see it. All right, so we've got one more question that I want to ask the panel, and then we can open it up for Q&A, and of course get back to having a drink and getting to know each other. But just, we're listening to our participants' voices, and I would love it if anybody wanted to share some thoughts about, the role of our participants, their voices, and I guess, for the audience too, are there opportunities of how we can expand this work into other countries, into other technical areas, and how can we get everybody involved? So, who would like to go first? OBB, you want to jump in?
Sure. Yeah, so Heartland Alliance has a very rich culture of human rights, because all the programs we implement are tied around the needs of the people that we serve is organic. If the entry point is mental health, for example, and in the course of service delivery, we find you need access to some other healthcare services, we do not say all we do is mental health. So the other service we do not offer. So we actually try to, and that is why we are very cost effective. If you have resources you want to invest in any organization, Heartland Alliance is the best place to do it, because we use the resources to do a lot more than what we have put down in our proposals. So for example, in Nigeria, our work, primarily what we are funded to do, is around provision of healthcare services, right? But because we use a human rights-based approach to providing services, we go to the extent of ensuring that the communities we provide services to have their human rights protected. We do everything possible to ensure that their dignity is respected, the spaces they go into for service delivery as safe as possible, sometimes at our risk, but of course, we are the torch bearers, right? They are the right holders. So we see our program participants as partners, as contributors to the solutions, not as problems. We do not see the service we provide to them as giving them handouts. We see service provision as a moral imperative that everybody deserves, and we are not doing them any favor, right? Because it could be OBB that is having that situation. So we are all the same, and it is with that lens that we provide services. So the community is actually the most important asset in the work that we do. They are the people. We are just supporting to bring out the best. And the world can be a better place if everyone have access to opportunities, if everyone have access to having their needs met, irrespective of how they look, irrespective of where they come from, irrespective of how they were born. Everybody can achieve their full potential if we are able to wrap our services around the needs, which are really is deep. It's difficult for us to just unpack everything I have said, but the summary of it is that every opportunity we have to provide services to any individual, we should be true to those services we want to provide, and we will be happy for it. The world will be a better place for it. The community voice is actually the strongest voice. And this is the last thing I will say on this. One of the ways to look at how progressive a society is to look at how they take care of the vulnerable in that society. Thank you very much.
Thank you. Do you want to add?
Yeah, I might add something to this about the participant's voice, and maybe add a little nuance to this. A kid sitting in a jail cell doesn't have a voice, and maybe can't exercise a voice. They're not really free to say what they think, and in certain circumstances, the fulcrum that we try to lever and we try to create change might be systems. And the voices that we might want to work on and listen to are those Iraqis who have the courage and ability to stand up for people who are voiceless. So I wanted to say that sometimes there's a little nuance. Sometimes you're looking at systems changes, and sometimes you're looking at activists or people who are in a position to work. There's grass tops programming, there's grassroots programming. But I would say in Iraq, maybe as an example for participants' voice, is I think our very effective collaboration with Iraqi women's organizations, who are led oftentimes by women who have suffered gender-based violence themselves, and who listen intently and closely and work closely with women throughout the country to give them a voice. I would also say, for example, in our LGBT work, we once set up we once supported a safe house for gay men fleeing Iraq that was in Damascus. This was before the war. That was run by gay men in Iraq for gay men. And I say gay men because lesbians in Iraq lead secret lives and rarely are noticed. That's a whole other issue. So I would just like to say that we genuinely try to not only incorporate the voices of the people we serve, but also to make them central to what we do. But the question of who we're serving is sometimes a little bit unclear, depending on who's able to have a voice and who doesn't.
Awesome. Well, why don't we go to the audience? Does anybody have questions or comments? More curious to learn? Alita.
OBB, I have a question. Okay, this question is for OBB. And it's going to show what I don't know. I'm just telling you. My good friend, Frank Mugisha, runs SMUG, the Sexual Minorities Youth Organization in Uganda. He was David Kato's lover when David Kato was killed. And now I do a little bit of work with my friend Frank because of the pernicious law that has been passed in Uganda. I'm wondering, with all of your expertise with LGBTQ work in Nigeria, if you do any other work with African countries whose LGBTQ populations are being, I don't think it's an exaggeration to say slaughtered. I say this to give you an example of two events that I know happened 2 weeks ago. One woman who was in a school, worked at a school, was accused of being gay. Accused, not, and she was drug out, beaten. By the time the police got there, they were stringing her up to hang her, and then the police cut her down and gang raped her in front of everyone. There was a transgendered man who had his genitals opened with a knife in the public square. And so I'm wondering if what you have learned in Nigeria could be of use to people in Uganda, and if so, could I connect you to?
Yeah, thank you. Thank you very much. And that is the lived experience of people, not just in Uganda, but Nigeria inclusive, and other parts of Africa. And we've had situations, actually, HAI's executive director then, I think it was Surita, visited Nigeria and had to reach out to the community because the issue happened around the time she was in the country when a transgender woman was killed. You know, it's horrible, it's terrible. Nothing should remove the sanctity of human life, but that is what we see in Africa. And so we have pretty much a well-organized response for the work that we do for that situation where somebody was killed. I mean, we didn't know how it started. We only got to know when the person was killed. So it was already too late. But situations that we get reports, we work very closely with the Human Rights Commission. So the Human Rights Commission is a body set up by government, but they enjoy a lot of autonomy. They work strictly with the law. They use the Constitution of the Federal. Interestingly, the Constitution of the Federal Republic of Nigeria, just similar to Constitution of many countries in Africa, does not discriminate, right? But some of the other laws that are set up, some of them are not set up intelligently. I'm sorry to say that, because they violate even the Constitution by criminalizing human beings, by preventing freedom of association, by preventing so many things that are already rights that are sustained by the Constitution. So we have our senior key populations advisor who is highly connected with other groups that operate in different countries in West and Central Africa, including Uganda and other parts of the world. So most of these situations, there are groups that are pretty much organized at regional level, country level, as well as the global level to try to intervene, to try to provide services, but most times in ways that are also safer for the service providers, because you need to be safe to be able to also provide safe services for other people. So, but we can talk more about that. Thank you so much for bringing that up.
Great. Thank you. I think we've got time for maybe one more question. Great.
Hello, this is Hassan Basha. I'm from Egypt. I'm here in a fellowship for 3 months, me and my friends. So my question is about Iraq, actually. So you're saying that you have set free like 1,000 kids from the detention, right? So I was asking about if we are working in the law itself to change the law about the kids to not be in jail because they like made a crime with being like ISIS or something. Also, what about the life after being with ISIS and get to the detention? What about the life after this? Because we're hearing that a lot of stories that if they have like a lack of education, a lack of services, a lack of everything. So I was asking about what about the detention? Thank you.
Well, that's an excellent question. And let me first start off by saying we haven't actually freed 1,000. We've probably freed about 20%, maybe if we're lucky. A lot of the kids still get convicted. There's a difference between getting a 5-year conviction and getting a 15-year conviction. There's a difference about being jailed with other children with somebody from the outside watching versus being mixed with adults and nobody with an eye on it. So I wish that we could get more kids out. I have to say, from the Iraqi perspective also, some of the kids who were 16 or 17, and recruited by the Islamic State, maybe the society views them as a risk, as a danger, and in some cases, to be completely honest, some of them are a risk. We have to acknowledge the violence of what happened and the risks involved, and the fact that kids are still recruited in jail and still maintain rather dangerous beliefs. We also have to consider the feelings of the community too. A lot of families tried very hard to keep their kids from fighting in this conflict, and when you release a kid who is affiliated with the Islamic State, and suddenly he gets trained to become a car mechanic. And your kid, who you managed to keep out, and who you were thoroughly victimized by the Islamic State, your kid gets nothing. That can cause a real tension in the community. So a lot of times with children involved in armed conflict, you have to be very sensitive to the community perception. And one of the other difficult things is that a lot of people in Iraq think these kids are ticking time bombs. So they don't want them back, even their own families sometimes. And they can, so far, thank God, we haven't had any of them killed going home, but boy, there's a risk of that. So that's a very complicated question. Also, we don't have resources. I mean, UNICEF funds us at a level of about $800,000. That's about $800 a kid, to try to keep them safe. And, you could spend $20,000 on a kid without any difficulty at all, just trying to get their communities back together so that they could reintegrate. So we work in resource-scarce environments, and that's important to know. That's why individual donations from people here are important. It's also why pressure on governments to fund things adequately are important. And it's also why a sense of both generosity and understanding for communities is important. There were people on all sides of this conflict. There were a lot of kids that were recruited by the winning side. A lot of the Shia militias that ended up winning the war recruited kids as well. And those kids have got different problems. They ended up with a lot more power than any 16-year-old should have running around with a Kalashnikov. And it's not easy for them to reintegrate either. So I think you just have to have a generosity of spirit toward the communities and toward the individuals and realize that it's very nuanced. And also realize that the amount of resources being devoted, even though Iraq gets a lot of resources, the amount of resources devoted to restabilizing the country and establishing civil society and establishing a stable society moving forward there's a lot of resource constraints. That doesn't answer your question entirely. I'm delighted to see you here. It's wonderful to have exchange students here, and I hope that we can interact more somehow. And I hope that we can find more room for people to either volunteer or become involved in what we do.
Nicely done. Thank you so much. I think we do have one more question over here.
Hi, I'm from the Dominican Republic. I moved 1 year ago to Chicago. Carolina, I came to support her, but also because of her, I've been so interested and involved in terms of stateless people, and I met Carolina working with Techo, building emergency houses for people in poverty situation. It's legit, just so committed. Not also with stateless people, but with everybody. And when you said and I learned that from you, when you said that stateless people don't have access to fundamental rights that are education, health, fundamental rights. I learned that from you, and I've been asking to myself, because even when we have made improvements and we have more connection with the government and their institutions, there are a long journey to build an end or at least reduce human trafficking and get rights to stateless people. So what do you think now that you've been working a lot on that? What can we do as individuals to so they don't have access to education and health? So what can we do as individuals to give them the opportunity to access to those things in the minimum? And also I learned from you, and you are my friend and my sister. But what can I do to keep giving the same information to other people and multiply this? And how can some of us join and be volunteers with you? Because we all are interested in end with human trafficking, and people deserve land to live and have rights.
Thank you, Emma. I mean, that was really emotional. Thank you for being here. I love you. So this is very tricky, to respond, because statelessness only can be solved by governments, right? They have the right to assure nationality to people. However, and this is a very interesting question, because this week have been 10 years since the Dominican government removed nationality for these people, for the 100,000 people. This week, we are having 10 years since that. But what we can do is raise awareness, keep the conversation on the table. One of the big challenges we are facing with this in the Dominican Republic is, even in the Dominican Republic, people do not know there are people stateless. And that's terrible. So I'm talking to someone in the streets, and I say, here we have more than 100,000 people in statelessness, and they say, are you crazy? That's not true. So it just keep going in the conversation, because right now what is happening in the Dominican Republic, because this is xenophobia and racism, because these people are descendants from Haitians. So what is happening is that these people have been having this battle by themselves in their communities. They are not even, some of them are not allowed to go out of their communities, because the migration would take them and send them to Haiti. But they don't know Haiti. They are Dominicans. They're born in Dominican Republic. They're raised in Dominican Republic. So we have the ability to talk this here in Chicago now. Here are people who are going to other places. We are part of international organizations. We are part of other groups. And we can keep talking about statelessness in the Dominican Republic, so the Dominican government can feel the pressure of the international community talking about this and can focus solutions on that, because we really need more support for the international community, so we can keep growing the solution for this situation. Yeah.
Thank you. We're good?
Question.
Okay, there's one person in the back. Yeah, there's one more.
Good evening, everyone. My name is Fasika. I am with the United African Organization. It's a local not-for-profit here in Chicago. I guess my question, thank you all for sharing your work and the amazing work that we do, and hoping to join you all in that work as well. But my question is, I think more for you, Melissa. You know, we earlier talked about, one, that Heartland has the Kovler Center, and there are probably another 14 or so torture justice centers around the country. Yet, we have only one torture justice center in the US for survivors of domestic torture. So, does Heartland Alliance, doing the work that it does currently around supporting survivors of torture, is there a plan for Heartland to get into that work to support survivors of domestic torture?
Thank you so much. Actually, I would like to invite, we do have some members of the Kovler team here. Can I put anybody on the spot with this question? Yeah. Mary Kay Hazel is our new director from the Kovler Center.
Can everybody hear me? I was not expecting to speak. I think your point is very well taken. It's a great point. So I am, first off, I'll preface this by saying I'm very new to the Kovler Center. I'm 1 month in. But Kovler historically has been the Survivors of Torture program. That has been Kovler Center up until about 2018. Since then, we have been exploring how do we expand this Kovler model, right, of looking at holistic services for people who have survived serious trauma and serious, migration and things like that. How do we apply that to other groups? And so, as far as I'm aware, we have not yet explored domestic torture survivors, but we are kind of in an inflection point right now where I think that is something that we could consider how that fits into our model. So it doesn't fully answer your question, but it is something. Yes, Mary is here. Yes, please.
Sorry. I could add what I do know. Oh, there's more Kovler people here. Yes. Hello. My name's Mary Black. I've worked at the Kovler Center for 30 years or something. And in regards to the Torture Justice Memorial that's in Chicago, which was found for survivors of the torture of John Burge, Kovler was, Bill Gorman in particular, who was a Kovler staff, was working closely with the staff there, and there was a lot of exchange going back and forth to help develop that program. And Mario Venegas, who's was at the event last night from Chile, is also, he's on the Client Advisory Board at Kovler, and I'm pretty sure he's still working with the Torture Justice Memorial. So there is partnerships. In terms of your question of expanding, that's a great question, I think, to see if this model could be used in other venues around the world, so around the country.
Thank you, Mary. Your context is much richer than mine. I think something that occurred to me, actually, as Mary is speaking, is a way we might indirectly support kind of domestic torture survivors, which is that we have a very robust student and internship program right now of people who come through Kovler to learn about our, torture treatment model, about our trauma treatment model, about all of this kind of holistic well-being services. And then those interns, students, counselors, social workers go on into a number of other positions. And so I think in terms of giving back to the wider ecosystem, that is something that we're doing right now. But your idea is an interesting one, and we'll certainly take it forward. Thank you.
Yeah. Thank you so much. And thank you, Mary Kay, for jumping in on that.
I just wanted to add briefly that Joby Cates Peterson, or Peterson Cates, I don't know her name exactly, that there is a program for survivors of torture, of police torture in Chicago, a social services program. It's rather small. I think it's an area where there should be a lot more interaction and a lot more effort nationwide, but there is one here, but rather small.
Great. Thank you so much. All right, so I just want to thank the panel one more time. We're so lucky. I have to say, I knew how exceptional my colleagues were, but to get to see them this week, talking about their programs, interacting with each other, sharing and learning. It has warmed my heart. It gives me optimism for the future of where Heartland Alliance International is going, and we're so grateful for everybody here's support of our programs and this community. And look at that sweet little baby. Okay, we need to get back to networking and having a drink, and I want to hold that baby. So thank you all for coming. We really appreciate it.